Welcome back. We'll take a look at some international news for you in a moment here on the Friday edition of the South African Morning. I'm Gareth Edwards. Tumelo is away for today. Charlotte Maxeke Hospital's continued closure is a humanitarian disaster. That's according to Wits School of Clinical Medicine head Professor Daynia Ballot. She has now started a petition to reopen the hospital. It was closed following that terrible fire back in April. Well, Professor Ballot joining us now from Johannesburg. Prof, good morning to you. It's quite a statement to make, a humanitarian disaster. Tell me more about the comment.
So, Gareth, I think the point is that the provincial health services, in fact, all the health services in our province, are already functioning to full capacity and sometimes over. So the loss of almost 1,000 beds from really, it's not even a major provincial hospital, it's a major national hospital, is just putting an unbearable burden on our existing health services. And we're not coping. So, for example, trauma admissions at Chris Hani Baragwanath at Academic Hospital have increased by about 50%. These are patients that would normally have gone to Charlotte. We have lost 50 intensive care unit beds from Charlotte. Already in winter, the medical admissions increase, and we are now in the COVID third wave. I think I looked this morning, and there are almost 4,000 patients hospitalized in Gauteng. And we just can't continue with this ongoing loss of a major, major health facility. So, we're calling for the reopening of the hospital. And I know that there are certain parts of the hospital that are structurally very badly damaged, but there are other parts that are okay. And we are calling for Premier Makura to declare the disaster that he was contemplating to facilitate the reopening of the hospital, because it's really placing an unbearable strain on our existing health facilities.
Help me understand, Prof, if a disaster is declared, obviously, for that hospital, what does that mean? I immediately think that we would be talking about the releasing of funds, urgent money needed to try and repair the damage there. Is that what you're referring to?
Well, we believe it would not only release resources, but it would also speed up processes, because it appears that we have become delayed by processes that are between three different government departments. So the building is actually not owned by the Department of Health. It is owned and managed by the Department of Infrastructure and Development. And then the occupational health and safety clearances are also given by a different department. So you've now got the Department of Health negotiating with these other bodies to try and get the proper clearances for the hospital to reopen. And it's taking an inordinately long time. And in the meantime, we are dealing literally with a health crisis. It's just, I represent the clinicians, the doctors who are members of the staff in my school, and the messages that are coming through is that the staff are overburdened and demoralized. Somebody made the comment that we've gone back to the situation that we used to see at Barra in the 80s, where patients are lying on stretchers in between beds. Patients lie in casualty for hours and days waiting for beds. It's not acceptable.
Professor, from a practical perspective, I'm talking about the building itself now. Perhaps for those who don't know the layout of the building, is there some kind of short to medium-term way of reworking that space, reallocating what is in certain areas of the hospital that is not a danger to the public? Because, yes, even though a disaster may be declared, you and I both know that'll be a long time before that red tape is cut. What are hospital staff saying to you? You know them intimately, don't you? Have they put forward suggestions as to how to change the layout of the hospital to try and assist?
So the hospital has already worked out a very good plan to reopen. It's just waiting for the clearance to implement it. So blocks 3 and 4 of the hospital, so the hospital is made up of 5 blocks, which are essentially 5 different hospitals, if you want to put it that way. And it's not one giant building, it is many buildings next to each other. So blocks 3 and 4 are structurally damaged and will not be able to reopen soon. But the other parts of the hospital are okay. And for example, they will be reopening radiation oncology very soon, because that building has been cleared for opening and can reopen. But it's the process, it's the time that it's taking to get the clearances to reopen those other sections of the hospital, which are in fact structurally sound. It's just an issue of getting the proper occupational health and safety clearances.
Professor, I'm going to say thank you, and I'll tell you what we're going to do with that information you've just given us. We're going to follow up with whoever it is that needs to try and sign off on these safety certifications to open these parts of the hospital and do exactly what you and your staff are suggesting. So I thank you for giving us the insight as to what is happening at Charlotte Maxeke Hospital. Joining us this morning from Johannesburg is Professor Daynia Ballot. She is from the Wits School of Clinical Medicine. She's the head of that school.